Hello, and welcome to our Eastern Regional Day of Service presentation, A Seat at the Table, Black Voices in Clinical Trials. I am Brittany Waddy, Second Vice President and Program Planning Chair for the Staten Island Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Thank you for joining us for this important conversation centered on health equality, representation, and future of medicine. Today's discussion is designed to help raise awareness about clinical trials, why diverse populations matter, and how informed engagement research can help improve our communities. For far too long, Black communities have been underrepresented in the medical research, and yet we are often disappropriately impacted by many of the health conditions that research aims to address. This is why conversations like this matter. We are honored to create a space for learning, reflection, and dialogue as we explore both the facts and lived experiences connected to clinical trials. At this time, we are honored to begin with a special greeting from our chapter president, Kellyta Murphy Reives.
Thank you, Soror Waddy. Good evening, and thank you for joining us for this Eastern Region Day of Service program, A Seat at the Table, Black Voices in Clinical Trials. I am Kellyta Murphy Reives, Chapter President of the Staten Island Alumni Chapter of Delta Sigma Theta Sorority Incorporated. As we continue our commitment to service in our community and community empowerment, it's important that we also create opportunities to address issues that directly impact the health and well-being of our families in our direct neighborhoods and communities. Clinical trials play a critical role in shaping the future of medicine, but that future must include all of us. So that is why representation in research matters, education matters, and trust in our medical communities matter. When our voices, experience, and communities are included in medical research, we help move towards more equitable care, stronger outcomes, and healthier futures for generations to come. We hope this conversation encourages learning, sparks thoughtful discussion, and fosters greater awareness about the importance of information and informed participation in clinical trials. Thank you to our speaker, Tinuoye and Janine Browne, and Cheryl Marks for their voices and expertise in this timely discussion. And thank you to everyone watching for being a part of this important moment.
Madam President, for those inspiring remarks and reminding us why this conversation is so important. Today, we bring together different voices from different perspectives to help us better understand clinical trials through education, professional insight, and lived experience. We are pleased to be joined by a panel of guests. First, we have Cheryl Marks, who will be sharing perspective as a clinical trial participant and speaking to the personal experience and process. We are also joined by Elizabeth Tinuoye, Clinical Program Manager at Mount Sinai Floster Heart Hospital, who helps in a key role in supporting clinical research and helping guide participants through the clinical trial process. And we are pleased to welcome Janine Browne, a pediatric nurse who brings valuable healthcare perspective on patient education, trust, advocacy, and the importance of community awareness. Thank you all for being here and lending your voices to this conversation. Let's begin by laying the foundation. For those who may be new to this topic, let's start with the basic. What are clinical trials and how are they important to our future of medicine, to the future of medicine?
So, clinical trials are research studies that test new treatments, medicines, or procedures in people. They're important because they help doctors to know what is safe, what works, and what improves patient care. Clinical trials shape the future of medicine by leading to better treatments, preventing harm, and supporting new medical discoveries.
Thank you. That gives us a strong foundation. Why is representation in clinical trials especially important for Black communities?
Representation in clinical trials matters in Black communities because we deserve treatment that are fairly tested, right? Works effectively and reflect their real health experiences. Greater inclusion helps reduce health disparities, improves trust in medicine, and leads to better care for all.
This is such an important point, especially when we think about healthy quality and outcomes. What are some of the biggest misconceptions people have about clinical trials?
I'm sure we've all heard our grandparents, aunt, uncles, great grandparents talk about the misconceptions of clinical trials and that people are treated like guinea pigs. It goes back to the Tuskegee Airmen. I'm sorry, not the Tuskegee Airmen, the Tuskegee trials, and that they only are for very sick patients and that participants are not told the risks. In reality, clinical trials follow strict ethical rules, including informed consent, and are carefully monitored for safety. Another misconception is that trials only benefit researchers, when they also help patients access new treatments and improve for future generations.
Those myths and misunderstandings are often part of what keeps people from even considering participation. That is why hearing real experiences is so important. Cheryl, I'd love to bring you to the conversation here. As a clinical trial participant, what initially led you to take part in a clinical trial?
Thank you, Kim. So I have been diagnosed with pulmonary hypertension, which is high blood pressure in your lungs, basically. And if your lungs are working too hard, it puts a lot of pressure on your heart. So it long term, it can lead to, just a problem with your lungs, but then heart failure. So I was I was approached to take part in a trial, that's not necessarily a cure, but it helps to lessen the effects of pulmonary hypertension. And I was really interested because um, I would say, ever since I was diagnosed, my mom suffered from the same condition. And so for me, it was very personal. She passed away very young. She was 52, I was 22. And when I was diagnosed with pulmonary hypertension, psychologically, I just assigned myself to the same fate. And I was like, well, I got a good 52 years that maybe I can, live my best life. Um, but then I started taking, and I remember a doctor said to me, I understand what you're saying, and I get you think you inherited all of this, but you're not your mom, right? And the world is a different place than when she was growing up with this condition. So I held on to that. I thought about it, and I became very proactive about my health. Um, so when I hit 52, I got a new lease on life, and I was like, I really made it. So I need to just go hard, do everything I can to ensure a long life. So that was really that was the primary thing that I knew I could rewrite my history. And so I just really started focusing on that. Um, and the other thing is that, I see the importance in my community, and I'm a strong believer in education. So someone has to learn, and the best way I think to learn is by doing. So in a way, I wanted to make the most unselfish decision for myself, but for also, future patients who suffer from the same condition.
Thank you for sharing that. What was your experience like as a participant, and what do you wish more people understood about the process?
So I'm actually on my second clinical trial right now, and the experience has been it can be a lot happening at once. It's a lot of information, so it can be overwhelming. But what I really want people to understand, like the best way to approach it is to ask as many questions as possible. Of course, there's the anxiety of the unknown. So, you're not sure what you're getting yourself into, but the best way to decrease that stress level and that anxiety and to advocate for yourself is to ask every question you can think of. And if you've gotten to the point where you're offered a clinical trial, I think it's because your doctor sees something in you, right? They think you're a good candidate, not only physically, but mentally as well. So if they believe in you enough to say, I want to offer you a spot, because not everybody can get into a clinical trial, but if they feel, confident enough that they want to offer you that spot, that means they want you to be part of this team, right? And as the patient, they're not going to learn more about this new medication if you're not upfront and honest and answering every question and asking every question as well.
That perspective is so valuable, especially for viewers who may only know about clinical trials from headlines and secondhand information. What concerns or questions did you have before participating, if any?
So, of course, I thought about the Tuskegee experiment. That was one of the things I didn't verbalize it, but I it was in the back of my mind. I thought about Henrietta Lacks.
Mm.
All those things that are part of our history. But I really think my biggest concern was side effects because you are going into something unknown. And again, the process is so transparent. It's an amazing process, and you should feel free to ask any questions you want, but you don't know what you don't know, and everyone is unique. So I thought about long-term effects. Like I was like, well, since I made it past my magical 52, I don't want to, mess it all up and get into this clinical trial and then, something tragic happens. But that was my number one concern that, you know, of the many potential side effects that they tell you about, that I would suffer from one or many of them. And I'm happy to say that has not been the case. So I'm very happy about that.
We are too.
That honesty is important because many people likely have similar concerns. What would you say to someone who feels hesitant or fearful about participating in a clinical trial?
I really do think it goes back to advocating for yourself, um, and asking every question you can think of, voicing every concern, and just being very honest with the medical staff, about what what you think might happen. And don't do it by yourself.
Mm.
Absolutely. If you're concerned, you have to, like I told everyone who knew me, I told my family, I listened to their concerns, right? They had some of the same concerns that I did. I told the chapter, and I always jokingly said, I'm going into this clinical trial. If I turn into a werewolf, it might happen. Just lovingly take me to get some of this hair taken off of me. um, but no, I joke a lot about it. That's one way I cope. But arm yourself. Have a prayer team around you.
Mm.
Have your family around you. And believe that you're doing this so that you will be healed on some level. Like your mindset and your approach is going to make that experience either better for you or worse for you. So always keep in mind that you're doing this for the greater good, but there is potentially something good that's going to come to you as well. And always ask as many questions as possible so that you feel comfortable with the process.
Thank you, Cheryl. Personal testimonies make this conversation more real and relatable. It also helps us better understand the support people need throughout the process. Elizabeth, I'd like to turn it to you. Can you walk us through what a clinical trial coordinator does and how participants are supported throughout the process?
Absolutely. Thank you so much for that question, Brittany. So as Cheryl Marks indicated, the process can be a bit overwhelming and patients can come to their appointments with a lot of questions, but we do our best to take a stepwise approach and guide them through this process. So the very first part is really identifying the eligible participant. And this can be done in various ways. They can be identified through a referral service. They can be referred via their clinician, or they might be identified by the research team. The next step is really the informed consent process. And this is the part where, as Cheryl Marks had indicated, where the participant gets to ask all of the questions that they may have. And this is not necessarily like a one-time event. The informed consent process can take a week, it can take 2 weeks. It's all dependent on the participants. And we encourage the clinical trial participants to bring whoever they would like to this visit so they can feel very comfortable, whether it's a spouse, a child, a caregiver, a rabbi, a priest, anyone that would help them feel more comfortable and help to support them through this process. So during the informed consent process, we're reviewing basically a legal document. It can be anywhere from 15 to 35 pages long. It has information in there about the overall, it summarizes the overall study, the risk, the benefits, what the randomization process is like. Sometimes that's a difficult concept for participants to wrap their brains around sometimes, like randomization, why am I being randomized? Why don't you just give me the drug? Just cure me, just make me better. So that can be a bit tough, but we walk them through it and say, you want us to take like a stepwise approach to this. So you want the very best care. So going about it via randomization is the best way to do it. And we're removing the bias out of it. So basically they can be randomized to an arm, like we call the placebo arm, where they're not really receiving any treatment, or they can be randomized to the treatment arm where they're getting the actual drug. But after the informed consent process and the participant feels comfortable and they agree, comes the screening process. And the screening process is really the part where we do blood work, we do imaging, everything that needs to be done to confirm that the clinical trial, this person is eligible for the trial. So after that step, then we get to determine if the patient, if you screen fail, that means that there is something in the imaging or the blood work that says, okay, this clinical trial is not for you at this time. But we don't drop the participants just like that. Our team, we actually refer them to another clinical trial that might be for them. But if you're not a screen failure, then you're considered eligible for the trial. And so the next step is enrollment. And as Cheryl Marks recently said, that's the big day. That's the day where you get randomized and you're like, okay, am I getting the drug? What are we doing here? Am I going to turn into a werewolf? Like, what's happening? So the whole team is there, and we're there to support them. And it can take anywhere from an hour to 3 hours. So it's a huge commitment. So that's why the informed consent process is the most important part, where I said it can take a week or two, because we want them to understand the time commitment. We want to work around their job schedule, their family schedule, anything to help support this. And the last part of it is really the holistic part, where once you pass the enrollment, we're following you for the length of the trial. That can be for a month or 4 years. So every part of your life, we're a part of it. If you go to the ER, we're present. We want to know about it. If you're hospitalized, if you go to urgent care, if you sneeze, we want to know. We want to know everything. If you cough, sneeze, anything out of place, we want to know. We're there for you. So that's all the steps in a nutshell. There's definitely more to it, but that's really the steps that we go through for the clinical trial participants.
This is helpful because many people may not realize how much coordination, communication, and care happens behind the scenes. What protections are in place to ensure that participants are treated ethically and safely?
Yeah, that's important, being treated ethically and safely. And there are many protections in place. The three big ones that come to mind, I'm sure people have heard of, is the IRB. This is the Institutional Review Board. So every institution has one, usually like a university, a research hospital, or a community hospital. This is the administrative entity that pretty much approves or rejects whether this clinical trial can move forward. They're reviewing the protocol, they're reviewing the risk, they're reviewing the mechanism of the drug. Is this something worthwhile even studying? Is it something that can be harmful to the participants? So that's one entity. And even putting that application through, there are also subcommittees. You can have the radiation committee that might be reviewing to make sure the patients are not being exposed to any unnecessary radiation. It can go through the cybersecurity committee. We want to make sure that we're not compromising participants' PHI, the personal health information. So that's one entity. The next entity is the FDA, the Food and Drug Administration. And this is the entity that the sponsors, also known as the pharmaceutical companies, they apply to the Food and Drug Administration to conduct this research. So they have their checks and balances in place, and they have to go through many steps, many applications to ensure that the study can even come to the hospital. And the last entity that I would say that has sort of like an oversight in the field is the International Council for Harmonization. And this is really an entity that gives guidance to people like myself and the physicians, the researchers on how best to conduct ourselves throughout the research. So they come out with the guidelines. There's such a thing as called good clinical practices. Everyone has to take this course like every 2 to 3 years. We have to adhere, how to treat participants, the length of time for informed consent. So there's a lot of guidance there. And again, these are just 3 institutions that come to mind. There are many, but these are the top 3 that many people should know about.
That is an important clarification, especially given the historical context that shape how many people view medical research. How do coordinators and medical teams help build trust with participants and their families?
Yeah, trust is a big one. And it's often something that we don't take lightly. And when I hear someone like Cheryl Marks speak and the fact that she's done 2 clinical trials, it makes me feel good that she found the team that works for her and that supports her. And I want that experience for every single person that's going to engage in research. But I guess the first way to build trust is really at that informed consent stage, bringing every single person in your life to that conversation, whether it's a daughter, a son, a spouse, a community member that you trust. That person should be a part of the process. But more importantly, in the Black community, we also see that folks rely very heavily on faith for their healing. So I think it's important when we're speaking with the participants to acknowledge that. And to understand that holds a special place within them and within their families, and to not take that away, but to just acknowledge that, the clinical trial is not here to replace that, but we're here to complement your spiritual practices and support it if possible. And I think the other thing to help build trust is to really, be transparent. We mentioned the Tuskegee experiments, and there is a whole lot of experiments that a lot of the people in our communities are aware of. So don't glide over that. Acknowledge it, be transparent, and take a pause if you need to. There will be people that will come to these visits and say, this happened to my mother, this happened to my grandmother. Don't overlook that. Take your time, pause, and listen and acknowledge that. And I think lastly, it's really empowering the participant by providing as much information as possible, as many resources as they need, as that their family needs. And I think lastly, encouraging open communication. I think when you put all those things together, there's no way that you can't build trust.
You couldn't have said it better myself. Thank you so much. Yeah, because that's so important. Faith, empowerment, transparency, those are all very important. My last question, what should someone know before deciding whether to join a clinical trial?
And there's definitely a lot to know, Brittany, but I guess the 2 top things that come to my mind is really just knowing that at the end of the day, it is voluntary. This is your choice. You can walk away, what we also call withdrawal from the project at any point and any time. You are not mandated to be there. But if you have questions, do know that in that consent form, there is the information about the IRB that has oversight for the study. So if you feel like you're being treated unfairly by the PI, who's also the clinician overseeing the study, or any member of the research team, I encourage you to reach out and make that known. But on the opposite side of that, if there's something that's working and the team is doing something well, I think you should let the team know that too. Reach out and let the team know like what works. And I think the very last thing would be clinical trials are important. And I think in our communities, people are faced with, lots of disparities, whether it's with heart disease, mental health, and just so many other issues. The clinical trial, participating in clinical trials gives us an opportunity to address these issues and provide some improvements and provide more representation for our people. So I think when you put all of that together, I would say those are the top 3 things that I would want people to know.
Thank you.
Thank you, Elizabeth. Education and transparency truly make a difference in helping people make informed decisions. Janine, I'd like to bring you in here from the nursing and patient care perspective. From your perspective as a pediatric nurse, why is patient education so important when discussing clinical trials and medical research?
Thank you, Kim. So, patient education is critical when discussing clinical trials and medical research, especially with increasing participation of Black women, because it directly addresses longstanding gaps in trust, as we've all discussed, access, and informed decision making. So, let's start off with patient education, building a system of trust that has already failed us in our communities. As we discussed, the Tuskegee syphilis study contributed to deep-rooted medical mistrust. And without clear, transparent education about what clinical trials involve, such as informed consent, safety monitoring, and participants' rights, many individuals are going to be hesitant to participate. So education creates a space to acknowledge this history while also explaining how ethical standards and protections have evolved, which would help rebuild the credibility that was lost. Secondly, education empowers informed decision making. I could never stress enough how the more you know, the better your ability to make a decision that you will feel is right for you and your family. We all know clinical trials can be complex. As Elizabeth stated, it could last for a month, it could last for 4 years. So it involves a lot of unfamiliar terminology, procedures, risks, benefits. And so when patients who are underrepresented in research, such as us, we receive culturally relevant information, accessible information, we're better equipped to make a decision that's based, that will be comfortable for us. And it'll also enhance our autonomy and support us in making informed health decisions. Thirdly, patient education is going to address disparities and health inequities that we've been dealing with since the beginning of time, if you ask me. Black women face disproportionate burdens of conditions such as maternal mortality, cardiovascular disease, and certain cancers. So when they're excluded or underrepresented in clinical trials, the resulting treatments could be less effective or less tailored to our needs. By educating us on why our participation matters, not just individually, but as a community and for future generations, we as health educators get to bridge that gap and promote equity in research. And finally, culturally competent education fosters engagement and reduces fear. Effective patient education goes beyond simply just providing information. It involves meeting individuals where they are, addressing every single concern that they may have regarding exploitation, clarifying any misconceptions they may have, and also incorporating community voices. For Black women, this might include acknowledging lived experiences, systemic racism that we deal with on a regular basis, and any stress-related health impacts that we have to face as well. So when education is respectful and inclusive, it increases the likelihood that meaningful participation and sustained trust in the healthcare system.
That connection between education and empowerment is so critical. How can nurses and healthcare professionals help patients and families feel more informed and supported?
So, nurses and other healthcare professionals, we play a central role in helping patients and their families feel informed. feel respected and supported, especially when navigating complex topics like clinical trials or medical research. This is not just about giving information, it's about how the information is communicated and how the relationships are built. So we have to definitely start off with clear, patient centered communication. We must talk in terms that our patients understand. Using all that medical jargon is never, ever going to work. Even if you are speaking to someone who may be in healthcare themselves, you still need to speak to them on a level that they would understand. So something that I often do, or every time I'm educating my patients, is ask them, what did you just hear me tell you? So instead of giving them large blocks of information and then expecting them to totally absorb and understand, I will break it down into smaller segments, so to speak, and say, okay, I just told you X, Y, Z. What did you hear me say? And that way I know if I can go on to the next set of information or if I need to pedal back and ask and reframe it so that they understand. I don't like my patients walking away just nodding their heads just because they want to get through the education part and not really comprehend what was taught, because that's how, lots of different errors and other misconceptions happen. And as Elizabeth stated before, we have to acknowledge the historical and cultural context that we've all, that our ancestors have experienced in the past. Instead of dismissing it, we incorporate it into our education piece and explain how now we've gotten a lot more modern. We have more ethical standards and safeguards like informed consent, like patient protection, so that we can kind of get rid of that fear and skepticism that they may have. We also need to be culturally competent and empathetic in our care. So we have to actively listen to our patients' concerns. So like Cheryl said, she brought all of her concerns to her family too, and was able to hear what their concerns were, and kind of maybe she didn't have that concern, but now that they brought it, she was able to bring that back to her providers and her clinical trial team and say, hey, these are certain concerns that I and my family have, because the patient is not just the only person you're educating. You're definitely educating the family too. So it's patient centered, but it's also family focused. So we also need to, another way we can help with that is connecting patients to outside resources and support systems, so that they can also have another outside outlet and meet other people that may be dealing with the same things that they're dealing with. And just finally, just creating a safe and a welcoming environment for questions. I always say the only stupid question is the one you don't ask, right? So if you have to ask the same question 6, 7 times until you understand it, by all means, ask away. And no provider should feel like their time is being wasted because the patient is asking the same question, or the family members have asked it, but in a different way. It just means that they need more understanding and more empathy as well.
Thank you.
Mhm.
That role of advocacy is so important. How does a lack of representation in research affect patient care, treatment, outcomes, and health equity overall?
So a lack of representation in research just means that like evidence guiding healthcare decisions is not fully reflective of the populations that are mostly affected by the disease. Um, So there's an impact on patient care, because if the clinical trial doesn't include diverse participants, um, we can diagnose a patient, we miss warning signs, and it also delays precise care because we've only tested a certain racial group or certain ethnic group and not looking at how it affects other ethnicities, other nationalities that will be fighting the same illness or disease. As far as treatment outcomes too, like Cheryl, her big concern was side effects. And let's be real, medications affect each and every person differently. If we do not include different groups as far as race, ethnicity, nationality, we're definitely not going to know what all the side effects are. And then we cannot cater and tailor their health care, because everyone's health care treatment plan, I should say, is going to be different based on how the medication affects them. Lack of representation just continues to reinforce mistrust in the healthcare system. And when individuals don't see themselves reflected in these studies, they're going to question if these findings are really going to apply to them. Is that really going to help me? I haven't seen not one person that looks like me being treated, but yet you're going to tell me that this treatment is going to work for me. It's just not going to align. And finally, it also, lack of representation undermines health equity by just continuing to perpetuate those systemic disparities and health inequities. So health equity aims to ensure that everyone has fair and a just opportunity to achieve optimal health, but it'll be difficult if we're not including everyone in our clinical trials. So representation is not just about fairness. It's about scientific accuracy, quality care, and justice.
That really brings this discussion to full circle. Representation is not just about numbers, it's about whether the care, treatment, and medicine truly reflect and serve all communities.
Yep.
As we think about next steps, I want to focus on what communities can do moving forward. What can organizations, churches, community groups, and local leaders do to help increase awareness and informed participation in clinical trials?
Organizations and community leaders can, and I would like to say, actually have an obligation to increase awareness of clinical trials by educating the community, creating trusted spaces for open dialogue and conversations, partnering with healthcare experts, and making sure people have the facts that they need and are able to debunk the myths so that they're properly informed and can make those informed choices.
That is such an important call to action. How can we begin to rebuild trust in communities that have historically been excluded from or harmed by medical research?
So we rebuild trust by transparency, being honest and telling the truth about the past harm, and that they can give informed consent, right? That they aren't the guinea pigs that our ancestors and forefathers have believed them to be. And listening to the community concerns, building those partnerships that create respect, protect, and benefit the people that are being served.
Thank you. Rebuilding trust requires truth, consistency, and intentional outreach. What is one message each of you hopes viewers take away from this conversation?
I would love one takeaway to be um, the the idea that while it might be scary, and like I said before, fear of the unknown can be a lot, that we owe it to our communities, to ourselves, to our families, to advocate for ourselves and to be at the forefront of some of these clinical trials. And this may sound like I guess like a scary truth, but if you've been diagnosed with something, you you have it, for lack of a better term, right? Um, so it's not going to hurt you necessarily anymore, because for example, if you have cancer, you're battling with cancer, right? You can try everything you can to beat it back, but you've received this diagnosis. So being afraid of a potential life-saving treatment is so counterproductive, right? Because it's kind of like, well, what do you have to lose? And I know that sounds negative, but it really isn't. It really should be a call to action. Like, hey, let's fight. Let's use everything in our power to fight. And if it doesn't work for me, or if it's too late to work for me, I'm still passing this on to future generations. So I hope one takeaway that people have is that, you know, what they do matters. Taking part in this, it matters. And it might not matter today or in 2 years, but 10 years from now, we could be the laying the groundwork for a cure.
I agree with Cheryl wholeheartedly. Knowing that there's such distrust in medicine, it makes being part of clinical trials even more important, right? It's hard to trust what you don't know. It's hard to trust what doesn't apply to you, right? But when we step forward and we volunteer as a community to take part in a clinical trial for something that we've already been diagnosed for, not only does it give us hope and opportunities to improve our own conditions, and on the off chance, or sometimes maybe guaranteed chance that it might not work for you, it does give your family, your other members of the community, and your community an opportunity to have access to medication and medicine that is designed for people like us.
And I mean, I'll add to that, exactly to what Cheryl and Kellyta was saying. Really, being involved in a clinical trial, it can really be an overall great experience. And I encourage anyone, like even if you're feeling scared or fearful, to do it anyway, because it really is a wonderful opportunity for you. And if not for you, for your children, your family, or it may benefit someone in the future. But being a part of a clinical trial, you can view it as a bridge to better health, stronger partnerships for you and your community. Because if you come, others will come too. You can take your experience back to the community and say, hey, this wasn't what I thought it was going to be. I actually had a better experience, and come along with me. And the wonderful thing about getting involved in research, when you find the right team, you're really in, I would say, like a protected space, because again, if one clinical trial doesn't work for you, there's no reason to feel let down or to feel like something's wrong with you. There's nothing wrong with you. It could also mean that, hey, you are much healthier than you thought. Like, you don't meet this criteria. And if you meet the criteria, it doesn't mean that you're less healthy, but it also means that you can make a difference. And we can find a clinical trial that can work for you and your family. It's a family effort, it's a community effort, and I encourage everyone and anyone, but especially those of us that are part of the Black and Brown communities to participate.
I would like to say, one, I think with us participating more in clinical trials, we would be getting away from that whole guinea pig mentality that this is what we are. Because at the end of the day, there may already be treatments out for whatever disease or illness you may have been diagnosed, but they may not be working, which is why we have clinical trials happening in the first place. But even if you were to try something that's been on the market for years, there's no guarantee that that's going to work. So why not be part of a clinical trial? And in essence, you're not only advocating for yourself, but you're advocating for your whole community, so that we also may be privy to these new treatments that are out there that may actually work for our genetic makeup, and be able to include more people. The systemic racism, we've got to stop it somewhere. And if we don't participate in these clinical trials, we're just playing into their hands, so to speak, and not including ourselves when we need to be included, because we are being exposed and diagnosed with diseases on a larger scale than our counterparts, but yet we are not being privy to the treatments that are the new treatments that are out there, because we're not participating in these trials. So advocate for yourself, advocate for your community, so that the word gets out there. That's it.
Thank you, ladies, so much. We want to thank each and every one of our speakers for sharing your time, knowledge, perspective with us today. This conversation reminds us that clinical trials are not just about research. They're about people, trust, access, equity, and future of healthcare in our communities. When Black voices are included, when our questions are answered, and when our communities are informed and represented, we shape better outcomes, not only for today, but for our future generations. We encourage you to continue the conversation. Share this recording, seek out reliable information about clinical trials and health advocacy in your own communities. Thank you for joining us for this Eastern Regional Day of Service, A Seat at the Table, Black Voices in Clinical Trials. Take care and thank you for watching.